MDMA.
Let's talk MDMA.
What is it?
Ecstasy.
Yeah. And what's the normal dosage of
Scientific
ecstasy
answer.
for people who use ecstasy?
Again, I couldn't tell you the quote unquote normal dose because honestly speaking, no one knows what they're getting when they're using it, right? It's not regulated. So
But the effects of ecstasy enhance sense of well-being?
at low doses, the answer is yes. I'm going to
Wait, he doesn't know what a standard dose is. How does he know what a low dose is?
tolerance, you develop the sympathomimetic effects, which are not so enhanced well-being.
Increased extroversion? That's a symptom.
Again, at low dose, you are 100% right. At low amounts, you are 100% right. It is an entactogen. We feel closer to people. That's what people who use it say. They feel close to people, warmth to people, 100%. But with continual use and higher doses, it can be fatal. Right. So that's not well-being. I don't know if I call that well-being.
So continued use at higher doses, MDMA can be fatal, correct?
Correct.
What if you took 8 to 10 tablets of MDMA?
What if you took again, you don't know what it's very hard to say that. You don't know what it's what's the word I'm looking for? Contaminated with. Okay, you can't just say, hey, let me just take 8 to 10 pure ecstasy and see what happens. That's not going to happen. So what I would say to you, again, because substance abuse are unpredictable, they are not regulated. No one knows what they're going to. No one absolutely has any idea whether it's going to cause this empathic entactogen effect at very low doses, or is it going to cause the sympathomimetic, increase, it's like a stimulant, like cocaine and something we talked about like that. No one knows what's going to happen. It's not regulated. And no one knows if you're using with other substances either, like other stimulants.
Or if you mix it with alcohol.
Or if you mix it with alcohol. No one knows if it's going to be potentially worse.
Right. But this is a potentially lethal combination. 8 to 10 MDMA tablets and alcohol.
This is a potentially toxic combination.
Right.
Can it kill you? Yeah, I mean, it is a potentially toxic combination. That's true.
Ever heard of someone cutting off their own finger on MDMA?
Have I ever heard of it?
Yeah.
No, I can only give you one example.
Hadn't seen that one before. Okay. So, Seroquel.
He was going to try and say Johnny Depp.
That one puts you to sleep, right?
If you want to phrase a barbiturate putting you to sleep, then the answer is yes.
Yeah, you heard Mr. Depp talking about sometimes being on the nod, right?
And again, I think I explained Seroquel very well.
I think I did.
Good. I'm going to ask him a few more questions.
Oh, okay.
All right. You kept making references to street value. Why were you doing that?
Because that's why people with substance use disorder use quetiapine and Seroquel.
Say it again, I'm sorry.
That's why people who use quetiapine or Seroquel it sells on the street because it's so barbiturate-like in effect.
Right, but you said that Mr. Depp had a prescription.
There are many substance use disorder patients who have prescriptions for Adderall and quetiapine from their doctor, and that doesn't mean they're not getting high out of it. That doesn't take much. Doctors like to believe what patients have to say. They're not going to go in there being expert witness testimony. All I'm telling you is that in people who have substance use disorder, it is not uncommon. And the thought was initially that because quetiapine was not addicting, that it's safe to give in people with substance use disorders, when in fact, we absolutely know it has street values. Absolutely know that for a fact.
Right, but my point about this is you made a bunch of testimony about street value, but you knew at the time you made the testimony that Mr. Depp, in fact, had a prescription.
He also had a prescription for oxycodone and roxicodone. Does that count? Because that's also
You're answering the question, bro.
Just because you have a prescription doesn't mean that
Mr. Depp would agree with you it wasn't a good thing.
Just because it doesn't mean you can't abuse it.
No, I'm not suggesting you're abusing it. I'm just wondering why your testimony was in any way tied to street value when every single drug you referenced, Mr. Depp had legally.
Again, you can have prescription substance abuse, and we know that, correct?
But what does that have to do with the street value?
We can have prescription substance use disorders, and that's not uncommon if you look at the opiate epidemic that we're living in right now. We can have that. That's not an uncommon thing.
What's it have to do with this
Unfortunate,
case?
but uncommon.
Nothing.
So, Seroquel, I think you described as a sleeping agent when used off label.
When I saw what?
Sleeping agent, Seroquel, when used off label.
When used off label, it's used. I can be used sleeping agent. Yes.
Right. So, Mr. Depp's use of Seroquel could account for some of the photos we saw in this trial where he's asleep in a chair.
Again, what I would say to you is that if you have a substance use disorder, you are using it to be knocked out. Yes, I agree. But I'm not sure at the end of the day if she'd have vomitus over you either, because I've never seen Seroquel do that. So when he was passed out in the chair, he also had vomitus over him. I've never seen Seroquel do that ever.
He didn't have vomit on him.
No.
He was passed out in
Nobody
the
saw
chair.
vomit. There's no vomit.
No.
Drugs you testified
Oh,
about.
It was ice cream.
That one's
Yeah.
also prescribed, right?
Yes, it is.
Choose writing a note that says it was
Yep.
ice cream.
What's it used for? And what's its indication, or what's its
Yeah,
used
what's its indication?
And
its
he's laughing
indication
about
is
it.
for seizures. It may have one pain indication. Again, I'm not a neurologist, so I can't tell you exactly if it does. But it's chronically used off label for pain. It's used off label for anxiety.
Right. And what's its effect? That's another one that'll put you to sleep, right?
Well, yeah. I mean, sure, 100%.
Right.
Yeah, sure.
And you made reference to a picture
Here we go.
Yeah.
Choose no.
around that picture that Mr. Depp fell asleep with ice cream in his hand. That's not vomitous, right?
I was told it was vomitous.
Oh,
Oh,
shit.
my
Uh-oh.
God.
Who told you
Um,
that?
You talked about the
No,
fact
keep
that
going.
Mr. Depp indicates that from time to time he uses an earpiece.
Ah, damn it.
I was, yeah.
You were
I mean,
told.
I
That
read
would
that. Yeah.
follow
Why
up.
would you let that go?
Did you read the testimony of Mr. Wyatt, who told you what was being pumped into that earpiece?
Yeah. I mean, if I remember right, I mean, I think it was lines, right?
No.
No, it was music.
Music.
It was music, not his line.
Yeah.
Oh,
So
oh shit.
if Mr. Depp was listening to music rather than being fed his lines,
Would that
So it's
change
not-
your
no,
analysis?
your
it's
opinion
the
as to his cognitive
Premises are
function?
correct, and the premises are not correct.
He was never fed his lines through the earpiece, which I know he was.
How do you know
Right.
he was?
How do you know?
What? Come
That may have been that example. Mr. Wyatt may have said that it was music. I guess the question is, were you
He's
having the music
Seems smiling.
during the actual talking of your lines? Is that what you're saying to me?
Well, if you can do two things at once, that's a pretty high cognitive function. Isn't it?
It's very good point. Actually, divided attention is something humans have a lot of trouble in. So, for instance, we have trouble driving and putting on using our cell phones and direct. So, divided
do?
attention humans actually are not very good at.
Maybe
I'll
for
put
you.
that out there.
But Mr.
In general, not just Mr.
That's
Depp.
not the
But
fucking
Mr.
question.
Depp is pretty good at acting. You acknowledge that early on,
Absolutely. Well, better than me, so I know that.
because you don't act. In fact, you don't know about acting.
You're right.
Doesn't even know actors rehearse.
You don't know how prevalent the use of earpieces are in acting.
Again, I know nothing about acting.
Oh my God.
Irrespective of the fact you know nothing about acting, you've testified that Mr. Depp's
Elaine is going to walk up and shoot this guy in the back of the head.
somehow a cognitive deficit.
So if I was giving a lecture and I was fed my
Your Honor,
lines,
can my entire
I'd think it's a
testimony
cognitive
please be
deficit.
stricken?
No,
Let me go.
and maybe I'm wrong. Like I said, maybe I could be wrong. Maybe Hollywood stars get
Maybe you're wrong in your
lines fed to them
professional
through
opinion.
earpieces all the time, and I don't know. That could be. It sounded to me to be unusual if you're doing a movie and you don't know the lines. But like
Sounded
you
to
said,
you.
I'm just judging it on what I do with lectures, and that would never happen.
If you gave lectures, you wouldn't use an earpiece, but you're not going to tell anybody how to
I mean,
act.
I've never seen a pirate with an earpiece before, so
So what was the question?
I said if you give lectures, you wouldn't use an earpiece, but you're not telling anybody how to act.
Right, I would not use an earpiece during lectures.
Right.
But I don't know what the standard for standard as Hollywood is for that. I have no idea.
Sir, do you know Jack?
Your testimony about the use of an earpiece.
No, I don't know Jack.
Maybe you were wrong. You're comfortable with the fact that you may have made a mistake there?
No, because I think in the basis of what I've read about it, I'm comfortable that I don't believe that
Hug the rest of this Gatorade.
given any prior earpieces.
Glug, 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 glug.
Yeah,
But-
and
but-
there's not one whit of evidence that this ever happened here.
I guess what I said. I just said I find it hard to believe. I didn't say it. I said I find it hard to believe. That's all I said.
Oh, yeah,
In the
but
absence of
what I
evidence.
found hard to believe, sir, was that every line of the script was pumped through an earpiece. Where did you ever get the idea that occurred?
That's what That's what I read, and the court review, the court evidence. That's where I got it from.
It's not
And,
in the evidence.
It's not in evidence. Yeah.
It's on evidence.
You know whether Marlon Brando used an earpiece?
Whether isn't he dead?
Yeah,
So the answer is no. He does not use one now.
He said did.
I used the past tense. Sir.
Oh, I'm sorry.
Yes.
I know nothing. I will concede to you. I know nothing about acting. I will concede to you 100%. If that is the standard and people are done that acting, then I apologize and that was wrong on my part. If that's the standard, I'm wrong. I don't know.
Okay. Let's go with that. No further questions.
Amber Heard's about to throw a vodka bottle at this guy.
A bit. You may want to take.
All right, let's go ahead and break for